deep-hearted gratitude to Dr. Tyagi for giving me this opportunity so that I can impart a specific and a very critical topic, that is safe delivery app, in the safe delivery app topic to this platform. And here we will be discussing like how the safe delivery app module, which has been also is the curriculum of BSc nursing program. And this particular module is being named as Safe Delivery App module. For this session, we will be discussing that how this particular module is empowering and saving the life of the mother as well as the newborn. As we all know that the major reason that this app was designed was like we are facing a global challenge. And this global challenge is not only like we are not experiencing it only in India or in Nigeria or any such Ethiopia kind of country, low resource setting, but we are also experiencing this type of challenges all through the world. It might be like in Myanmar as compared to the other resource settings, but it's a global issue. So, for addressing this entire global issue, where the maternal death occurs in every 2 minutes, and the reason the maternal death occurs is either related to the childbirth or related to any such causes. That means it can be the delay in identifying the symptom or to identify the risk, delay in reaching the healthcare facility, and delay in decision making. Right. That means to choose which hospital will be best or where should we go to take that care. So related to this, the major reason is like in every 2 minutes we are seeing a maternal death. To that, a newborn in every 7 seconds. And majorly these deaths are occurring when it is entirely preventable. It is not at all like we can't prevent it. The deaths are preventable, but still there are a higher sites of maternal and newborn death. Third major reason is the resource gap. Resource gap we can see many of the metro cities and all. If I talk about Delhi, if I talk about Mumbai and all. So if we talk about the urban area, the resource settings, the facilities, the care provided, everything is better as compared to the rural area. Similar to that, the countries who are already developed countries like the great United States of America, they have a good resource and hence they also have very skilled professionals, skilled healthcare professionals. But that is not the same in the countries which are still developing, or we call it low resource setting countries like India, Ethiopia and all. Here we might be having the care provider. If I talk about the small rural area of any rural outskirts of Uttar Pradesh, so we might be having a healthcare provider there, but it is not necessary that healthcare provider might be enough skilled. So that is the major reason of because of which this maternal and neonatal deaths are there. Now, why a country should invest in maternal health? Why it is important? Why? Because it saves lives, and it not only saves life, it saves lives. That means if you are saving a mother, ultimately you are able to save the child. So हम 2 जाने बचा सकते हैं. तो save life, 2 जाने बचाने के लिए प्लस इससे एक healthier society बनेगी. Why? Because if you are investing in maternal health, ultimately a healthy mother will result into a healthy family, where she will take care of the family, she will be involved in the family care, and from a healthy family, we will be having a healthy society. So, yes, that is an important reason why we have to invest in maternal health. Then, to reduce the economic thing, lakhs and lakhs of amounts for the healthcare facilities, for uplifting of the healthcare system. And जितनी ज्यादा मॉर्बिडिटी होगी उतना ज्यादा हेल्थ केयर पे और पैसा लगेगा. तो डेफिनेटली मॉर्बिडिटी को कम करना, अल्टीमेटली मोर्टेलिटी को कम करना, और उसकी वजह से जो खर्चा सरकार का हो रहा है, क्योंकि अल्टीमेटली हमारा ही पैसा है, उसका भी जो नुकसान होगा वो कम होगा। इसलिए इकोनॉमिक लॉस को हम प्रिवेंट कर सकते हैं अगर हम मैटरनल हेल्थ पर ज्यादा ध्यान दें। और अभी प्रीवियस स्लाइड में वी हैव डिस्कस दैट हाउ कम दिस मैटरनल एंड न्यूनेटल हेल्थ इज अ ग्लोबल चैलेंज। Next thing that why we should invest in maternal health is that it is the key in achieving the SDG, that is Sustainable Development Goals, which is being given by UN. Under that Sustainable Development Goal, a healthy living, that is the SDG 3. Under that SDG 3.1 and SDG 3.2 are very much relevant to upliftment of maternal health. That is, in SDG 3.1 clearly states that by 2030 there will be that the goal is to reduce the maternal mortality 70 deaths per 1 lakh life birth, which is in some of the country in the country like India is up to the is 171 lakh per 1 lakh life birth. So to reduce it to 70, and 3.2 is to end any such conditions which are is to actually end the preventable death of newborn and children under 5. So these two SDGs are totally linked. Only if there is an investment in the maternal health, then only these two SDGs can be achieved. Now, coming to the topic, I just gave a brief, the reason that why it is important to have this app. So, what is the Safe Delivery app? As you just, if you just presently, if in current, if you visit the Google Play Store, you can simply type Safe Delivery app. The picture which you can see in the screen, the same picture will appear there. So what is it? This Safe Delivery app, okay. So this picture what you see in the screen, it will appear in the Google Play Store. And what this is actually the Safe Delivery app. It is a mobile-based digital application. You can even download it in your computer, in your PC, desktop or whatever, in your iPad and all. So it's a mobile-based digital learning tool which is designed it's designed for the midwives, A&M, community health workers and all, so that they can provide safe and quality maternal and newborn care. Right? What this app does, how it works. This is just a brief overview that it is actually a similar app what we use in as our WhatsApp, as we are using your Ola, Uber, similar to that. It's a mobile-based application, and as you click on it, it will be having various features. So how this app was developed? This app is the point that I would like to mention is like this app is an evidence-based digital tool. If I say evidence-based digital tool, that means all the content, whatever is provided there, all the researchers which are being included there, everything of all the detail, all the procedures, what are being provided there, they are all evidence-based. That means there are specified researchers on it. There has been various papers published on it that has shown that why this particular measure for treating PPH is effective. Right? तो मतलब हर एक चीज के पीछे एक strong evidence, एक strong result associated है जो भी उसमें मॉड्यूल्स प्लेस किए गए हैं ऐप में वो सबके लिए, तो इसलिए इसे एविडेंस बेस्ड डिजिटल टूल कहा जाता है, which has been developed by Maternity Foundation in collaboration with the University of Copenhagen and Southern Denmark. As I told before, this app has been designed for the midwives and healthcare workers to provide them the critical information and guidance, right? So critical information and guidance, as in sense like we might be knowing many midwives who have completed their BSc nursing, MSc nursing or a GNM nursing might be 20-25 years ago. So as such, if we talk about practice, they might be practicing midwifery, they might be working in the labor room, but in sense of knowledge, there might be certain content which might be lacking. हो सकता है कि कुछ चीज एकदम से दिमाग में नहीं है अभी, तो अगर वो लोग अपने नॉलेज अपग्रेडेशन या रिफ्रेशमेंट करना चाहते हैं उस केस में. सेकेंड, अगर कोई न्यूली ज्वाइन नर्स है जो कि अभी लेबर रूम में पोस्टेड है या किसी एंटीनेटल वार्ड में पोस्टेड है एंड शी इज हैविंग दैट नॉलेज, राइट, बट suddenly an emergency never occur daily. एक इमरजेंसी डेली नहीं होती. इट माइट बी occurring once in a blue moon, or it depends on the the situation of the community nearby. So accordingly the emergency can occur. So कभी भी अचानक से कोई इमरजेंसी होने में that there might be possible that the fresher nurse, a newly joined nurse might get totally blank कि इसमें क्या करना है. So for a quick reference, she can simply take out the mobile, can click the app, and can go through that what can be done. Like I will just show it, like how they have included an action component in it, and that actually helps to take an actually help to make a prompt decision making. तुरंत decision making के लिए बहुत मदद करता है. सबसे बड़ी बात, in a country like India where we talk about digitalization, but still many of the areas they are poor, they have poor network issues, might not be having good internet connection, and our midwives are working in those communities as a community health officer. So the best part of it is it can work in an offline mode also. ऐसा नहीं है कि इसके लिए इंटरनेट कनेक्टिविटी ही चाहिए, बिना इंटरनेट के आप काम नहीं करेगा. इट्स नथिंग लाइक दैट. It has an offline functionality. It can function if you don't have the internet, then also you can see all the videos, you can go through the action cards and all. And it is very much useful in a very limited resource environment because it gives and rendering a vital knowledge. So we can just summarize that Safe Delivery app is actually a mobile-based application. It is an evidence-based digital tool. It provides clinical guidelines as per the standard. As per the standard मतलब is nothing like this मैंने लिख दिया या किसी के कहने पे किसी डॉक्टर ने बना दिया, nothing like that. It has a standard guidelines which is being given by WHO. Okay, and this particular app has been undergone a pilot test in 2013-14 in Ethiopia, and it has shown a remarkable impact. That means the midwives who are using it have shown a strong impact in the quality of midwifery care. So the major module, the major components that are included in this app are, there are 12 comprehensive clinical modules. There are animated videos of various procedures demonstrating step by step. There are quick action card. For example, आपको PPH का मैनेजमेंट एक लो रिसोर्स सेटिंग में कैसे करना है, उसके लिए एक डॉक्यूमेंट ओपन होगा, आप वो पूरे डॉक्यूमेंट पढ़ते जा रहे हो, पेपर स्क्रॉल कर रहे हो, टाइम लग रहा है, नथिंग लाइक दैट. In those conditions, you can simply go to action card. In action card, there are checklist kind of items. You can just see, yes, we have done this, we have done this, I have done this. So, in concise and very precise manner, okay, that the management is given for emergency condition, and then there are certain drug protocols. That means for effective management of conditions like PPH and all. So I will just give you a demo, like what all things are included in this app. So we can just see. So these, through this app, we have seen like how. So through this app, we have just now in the video we have seen like these are the basic four important components which are included in the app, and accordingly, whatever is required, it can be played, downloaded, and can be visualized. What is the key important feature or the the best advantages of this is all the video of the any procedure, for example, antenatal care, antenatal examination, postnatal examination, breast examination, then the family planning devices, everything. All those procedures are being are actually animated videos, and those videos can be downloaded. Then the procedures, all clinical procedures, entire drugs which is being used in obstetrics have been mentioned with all side effects, dose, and everything. Then the best part is this app also have a e-learning certificate. That means if the learner have read the particular module or have read a particular procedure for say let it be antenatal examination, okay, and after that the user can also attempt a quiz on antenatal examination. So when you attempt that quiz and if you score a higher percentage, they will be the app will be giving you a e-learning certificate, and that is being named as Safe Delivery Champion. Right. So after completing each and every procedure, after visualizing each and every procedure on the clinical module, you can attempt such quiz because that actually enhances active learning, self-learning of the user. Because of that, and that ultimately helps in collecting various certificates. Next thing is this app is multi-language, as I have seen, we have just seen in the video. 20 plus languages are there, including English, one of them, and it is also a totally offline functionality is there. So the various clinical modules which are included in a safe delivery app are normal labor and birth, postpartum hemorrhage management, neonatal resuscitation, maternal sepsis, all those conditions which are actually a situation of emergency. Where sometimes in very hurry or in some type of, and in case of some local resource setting where there are not appropriate resources available with the nurses. Okay, what is the available resources, and in that what all functions she can do, how she can best care the patient or the client. So these are the modules which is being provided. Now the safe delivery app benefits will be discussing, and these benefits are, it is not particularly related to India. I will say in terms, we will discuss in terms of global benefits. That first, being a nurse, midwife, being a student nurse also, if any of the participants, the students are, are doing BSc nursing, if they are attending this particular session. So in them, you guys can simply download this app, and all the procedures which your teachers might be teaching you, or the disease or the emergency conditions which are being taught to you, like PPH, prolonged labor, preterm labor and all. So all those conditions can be seen through this mobile app. तो इसमें जरूरी नहीं है कि बच्चा क्लास में मोबाइल ना देखे. टीचर अगर वो टॉपिक पढ़ा रही है तो बच्चों को सिर्फ ये ऐप डाउनलोड करने के लिए बोलना है. बच्चों को वो ऐप से हम उनको वो पूरा टॉपिक जो है वो समझा सकते हैं. और इससे व्हाट विल हैपन दैट डेफिनेटली जो बुक में होता है, द बुक आल्सो गिव्स द रैशनल. हम भी ये बताते हैं कि ऐसा क्यों हुआ, if there is bleeding, why in PPH bleeding occurs. So similar type of entire rationale is been provided here that helps the student to boost their knowledge and confidence. Definitely the theoretical knowledge and confidence of the student nurse, and in a clinical area where the nurse is practicing, there also it helps to boost the confidence. Then, as I told, it is very easily accessible. Very easily accessible. Only thing is that the person should have downloaded that सिर्फ उनके मोबाइल में, क्योंकि आजकल मोबाइल तो इट्स लाइक द नेसेसिटी, उसके बिना तो रहना पॉसिबल ही नहीं है. तो हर किसी के पास मोबाइल है, उस मोबाइल में सिर्फ उस ऐप को डाउनलोड करना है. अब किसी भी रिमोट एरिया में है, अब कितने भी ऐसे एरिया में है जहाँ पर कोई नेटवर्क कनेक्टिविटी नहीं है, ये ऑफलाइन मोड में भी चल जाएगा. ओके, और आप सिर्फ अपने रिवीजन के लिए भी, इवन द पर्सन दोस्त हैव ऑलरेडी डन एमएससी नर्सिंग माइट बी एन ऑब्स्टेटिक नर्स, but still we all need to brush the knowledge some or the other time. So we can also go through the app and can look after the various updates. Best part which is being done here in this app is it is getting updated. इसमें हमेशा जो भी नई चीज आती है उसके अकॉर्डिंग इस ऐप को टाइम टू टाइम अपडेट किया जाता है. तो अगर आपने अपना मास्टर्स का कोर्स या बीएससी का कोर्स बहुत साल पहले किया था तो सिर्फ अपने नॉलेज को अपडेट करने के लिए भी आप इस ऐप को फॉलो कर सकते हैं. A standardized guideline, I have already discussed that these guidelines are as per the WHO and national protocols, and they are practiced across entire India. Decision support, quick reference for emergency. That means if there is PPS, eclampsia, neonatal resuscitation, कोई भी चीज है आपको अभी करना है वो चीज बट आपको समझ नहीं आ रहा कि कैसे करें. वी हैव डन इट इन अवर स्टूडेंट टाइम, तब प्रैक्टिस किया था, अचानक से इसमें बच्चे पे करना है, that you are not getting that confidence to perform, right? So in that condition, you can go through this app and it will help for a quick reference, right? And definitely, किसी चीज को गलत करने से बेटर है कि हम उसे एक बार पढ़ ले, एक बार देख ले, ना आप एक बार उस चीज को देखें कि परफॉर्म कैसे करते हैं, क्योंकि here it is not about any particular machine. We are actually practicing, we are actually working or dealing with, I must say, we are dealing with human life. तो कोई सेकंड रीटेक तो होगा नहीं यहाँ पर. तो पॉइंट ये है कि अगर आपको किसी भी प्रोसीजर को करने में कॉन्फिडेंस नहीं है और आप ही एक नर्स हो उस पूरे क्लिनिक में या उस पूरे कम्युनिटी सेंटर में, तो बेटर है कि अपना नॉलेज, अपने स्किल को एक बार रिवाइज करने के लिए इसमें जो भी प्रोसीजर के मॉड्यूल्स दिए हैं उनको एक बार ब्रश अप कर लीजिए, देख लीजिए और उसके बाद परफॉर्म कीजिए. अदर देन दैट लैंग्वेज और यूजर फ्रेंडली है. 20 से ज्यादा लैंग्वेजेस इसमें है ऑल ओवर ग्लोबल लेवल पर, चाहे अरेबिक हो, ठीक है, तो ऑल दोस लैंग्वेज आर देयर. और वॉइस ओवर्स है, वॉइस ओवर्स है दैट मींस कि यहाँ पर जो एनिमेशंस चल रहे हैं, एनिमेशन में इफ द नर्स इज परफॉर्मिंग अ प्रोसीजर, राइट, तो वो उसको बोल भी रही, तो हमें वॉइस ओवर्स इलस्ट्रेशन से काफी समझने में आता है. नेक्स्ट, कैपेसिटी बिल्डिंग के लिए बहुत जरूरी है, जो कि जो ये प्रोग्राम है कैपेसिटी मिडवाइफरी कैपेसिटी बिल्डिंग आईएनसी अलोंग विद द वेरियस सिमुलेशन लैब्स एंड ऑल दे आर वर्किंग ऑन इट. तो उसमें का एक कि ये बहुत इंपॉर्टेंट पार्ट है कि हम एक लार्ज स्केल में अगर मिडवाइफ्स को, नर्सेस को मोटिवेट करें तो हम उनकी ट्रेनिंग कुछ हद तक इस ऐप के थ्रू भी कवर करवा सकते हैं. मैटरनल यूनिटल आउटकम पर तो डेफिनेटली असर पड़ेगा, क्योंकि दिस ऐप will result into a decrease in maternal and newborn mortality and it will ultimately help in the improvement of antenatal, intranatal and postnatal care. कॉस्ट इफेक्टिव ट्रेनिंग है, आपको इसमें रजिस्ट्रेशन करने के लिए कोई फीस देने की जरूरत नहीं है, आपको कोई बहुत बड़े क्लासरूम की जरूरत नहीं है, आपको 1-2 घंटे के सेशन के लिए इस ट्रेनिंग को बिल्कुल भी नहीं है. सिर्फ अपने मोबाइल पर आप ये सारी चीजें खुद ही देख सकते हो. तो इट इज फ्री, सस्टेनेबल एंड एक्सेसिबल टू. तो ये फ्री है, सस्टेनेबल और एक्सेसिबल है, जो सभी के लिए आसानी से पॉसिबल है गो थ्रू कर. रूरल इंडिया के लिए ये सबसे बड़ा वरदान है, क्योंकि जितने भी हमारे आशा वर्कर्स हैं, एएनएम्स हैं, फॉर देम इट इज अ यू नो इट इज अ व्हाट टू से अ काइंड ऑफ टॉनिक, आई मस्ट से. व्हाई? बिकॉज साथ ही साथ जो दूसरे गवर्नमेंट के प्रोग्राम है, लक्ष्य और जननी सुरक्षा योजना, उनको भी कॉम्प्लीमेंट करते हैं. मतलब उनका उनमें जो बातें लिखी गई है वो सारी चीजें इस ऐप. नर्सिंग एजुकेशन के लिए मैं थोड़ी देर पहले ही बता रही थी कि नर्सिंग एजुकेशन के लिए ये ऐप इसलिए अच्छा है क्योंकि वो मोनोटोनस क्लास जहां पर यू नो द टीचर्स आर सिंपली गोइंग विद द बुक और समटाइम्स माइट बी विद द पीपीटी एंड दे आर गोइंग एंड जस्ट गिविंग द लेक्चरिंग अराउंड द स्टूडेंट फॉर 1 आवर, 1 घंटा जाकर बोल जावे. सो मोस्ट ऑफ द टाइम इन दैट टाइप ऑफ ट्रेडिशनल मेथड ऑफ टीचिंग the students just remain a passive learner. बच्चा सिर्फ सुन रहा है, बट वो सुन के समझ रहा है या नहीं वो हमें नहीं पता चलता, क्योंकि बच्चा आपसे डिस्कस नहीं करता. देयर इज नो कोलैबोरेटिव लर्निंग ऑफ ब्रेन, राइट? सो बट दिस ऐप इज एक्चुअली अ बेस्ट वे टू मोटिवेट स्टूडेंट्स फॉर सेल्फ लर्निंग. Secondly, if teachers have downloaded the app in in the laptop or all, the videos which are being played there, the procedures which are being given there, it can be taught to the entire class, can be shown to the entire class with the help of a projector. So उससे क्या होगा, teaching learning will become very interactive with the help of those visuals and video. It's a self-paced learning. Self-paced learning, that means like आप कोई वीडियो बीच में आपका मन किया कि ठीक है, let's take a break, you can pause it there. आप उसको वहीं pause कर दीजिए. आप जब जो भी आपको ब्रेक लेके बाद जब आपको पढ़ने का मन करे दोबारा फिर से कुछ you want to go through, then you can start with the same value left. जहाँ से आपने छोड़ा था आप वहीं से फिर से उसको शुरू कर सकते हैं. So it's a self-paced learning. It enhances critical thinking, and in simulation labs, if we are using it, if the teachers are using it before procedure आप बच्चे को दिखाने वाले हो एंटीनेटल एग्जामिनेशन का, उससे पहले आप एक प्रोजेक्टर में इस ऐप के थ्रू एंटीनेटल एग्जामिनेशन का जो प्रोसीजर है बच्चों को दिखा, right? And then we can and then demonstrate it, and with the help of simulation mechanical, we can best make the student to perform it, and they will also think कि मैम उस ऐप में तो ऐसा नहीं हो रहा था, उसमें उस नर्स ने ये किया था, then क्यों किया था? So that Q वाला point is something which is critical thinking, which enhances critical thinking. So that can be done, and it will help to improve the confidence of your students and our students in managing the emergency situation. The benefits for अगर वो these were the benefits for the nursing educators like us. But those nurses who are working in the clinical area, for them, it is the app which will support their decision making. It is totally standardized. ऐसा नहीं होता कि बिहार के एक हॉस्पिटल में दूसरा दिखा रहा है, यूपी में कुछ दूसरा दिखा रहा है. Nothing like that. App will remain standard all through the global scenarios, and it reduces the error. Yes, आपको डाउट है तो आप एक बार चेक कर सकते हो कि ऐसा की डोज है ना, प्रोसीजर यही करना था ना, right? Especially in cases of PPH and all. So it helps to reduce the error, and it improves the patient's trust. Patient satisfaction. Quality of care improve that. So these are some of the benefits for clinical side. So actually, so we have my teachers, we have a good simulation lab, because we in the university we follow active learning strategies. So basically, this app and the videos given here are very much interactive in it, and it helps in the skill building of the students. How? Because it totally focuses. The teaching strategy involves active engagement of the student, right? No passive learning, no rote learning. It is actually active engagement of the student. How? As I told, by quiz, the students can appear. How many certificates you have? Definitely that much confidence will be boosted. You will be more motivated, right? And the certification is of 1 year. It takes a वैलिड रहेगा, क्योंकि 1 साल के बाद अगर आप देखना चाहो कि क्या नया अपडेशन हुआ है, you can again attempt you can again go through the same this modules and procedures. Now what actually कितना इसका impact है, हम बातें कर रहे हैं ऐप के बारे में इतनी सारी, but ग्लोबल लेवल पर क्या है कि 375K for this is the supporting research or the evidence, the study which is being conducted foundation paper in the website of October midwives or the health where before treated for significant improvement in 65% of the confidence. It also this have also resulted in increased confidence from 16%. So even the best part, this app has also played an important role in the time of COVID-19. How midwives can protect themselves and also the mothers, okay, at the time of this challenging situation. And this particular section of COVID-19 is been developed with collaboration of Lateral Global Health and ICM. What are the users' experiences? The users, according to them, it is very intuitive idea, something very new, something very novel. It is something which is designed for quick navigation. No need of any OTP, no need of any internet and all. So it's quite easy to navigate, to go through it. It's offline function and flexible learning. That means whenever you have time, you can just go through the learning, and when you are busy, you can just pause it, and again you can connect it at the time whenever you have time. So the vision for the development of for this safe delivery app is safe for birth for all, and it should not cost life to give life. That means if you are creating a life, right, it should not cost. किसी और की जान पर खेल कर, किसी और की जान लेकर आपको किसी की जान नहीं बचानी. So the point is, in order to have this app can take care of the midwives also. Okay, you have to protect this app actually protect the rights of midwives also. If they are doing something wrong, which will be definitely harm the mother or harm the client, तो बेटर है कि मिडवाइफ का भी नुकसान होगा, उस मदर का भी नुकसान होगा. इसीलिए बेटर है कि दोनों का नुकसान ना हो, हम ये ऐप को फॉलो करें, जिससे कि जो मिडवाइफ है वो क्वालिटी केयर डिलीवर कर सके और अल्टीमेटली हम जो पेशेंट्स हैं उसे भी सेव कर. So according together with WHO guideline, it also included the standard guideline of ALSO, that is Advanced Life Supporting Obstetrics. So at the end, I will only urge all the students, faculty who are, actually just listen to me. I will just ask and request to people that we all can or should download this app, and it's the part because this app is actually helping out to curtail or to decrease the global challenges of maternal and neonatal mortality. Thank you so much for your patience listening, and once again I am thankful to the principal sir and also to the organizing committee for giving me this chance and for giving me this opportunity. Thank you so much. Hello.